Greetings to everyone. Yesterday we had the first day of our conference. Today we are happy to see some new people. We understand that we work not just for ourselves, but there is understanding between us and many other people. I would like to give the floor to the representative of the alliance, Miroslava Andrushik, and that the alliance that supports us. I would like that today we're talking not just about some achievements and good things that we have, but I would like us to mention certain challenges that were mentioned, that the donor support is going is reduced and there will be less and less of it. The time will come when you have to take everything in your hands. You will have to find support of other donors, just global fund, and you need to move forward. I will not take a lot of your time. I would like to tell us, let's work together. Thank you, Miroslava. That's not a simple event. We are living in conditions when the funding is reduced, when it's more difficult to get some funding for such events, and Miroslava did a lot for this to happen. That is why we appreciate it greatly, Miroslava. I thank you from myself and from our community. Let's discuss our topic. Yesterday we were talking about our main directions of work. We collected all the ideas to be included into the roadmap. Today we've heard about implementation of MKX 12 and how to involve community into it, because we are working according to the principle nothing about us without us. No, a single product could be created without the desire and ideas from the future users. And because trans community is one of the most interested groups in implementation of MKX 11, because the diagnosis was excluded, and we are interested in that when that is implemented in Ukraine from the 1st of January 2027, and the transgender people will not be considered to be psychologically imbalanced. And so we have here the specialists who are working with the communities in these directions all the time, and we'll be talking about that from the point of view of the rights of the community. It's about the violation of the rights of the community, ensuring some of the rights in counteracting the gender violence, and also we'll be talking about ensuring the rights to the community on exclusive medical support. It's like ensure the testing for HIV and STDs, and we invited one of the leading endocrinologists of Ukraine who's working on the issues of the hormonal therapy. Will be now using the term gender supporting therapy. This will be the new abbreviation which we'll be using. First, I would like to give the floor to Vitaly Matveyev, the head of the NGO projector. He's the lawyer, the council, and he will talk about violation of transgender rights in Ukraine. Cannot hear? Yep. Not more than 15 minutes. Okay, I understand that. Greetings, dear friends. I'm Lev Matveev, the head of NGO Projected. Today we'll be talking about the military medical commission. We know that the centers of the support, the sound gets interrupted. Sorry, the sound gets interrupted. The first question we have when we go to military medical commission, the first question is, and who are you? And the person who already did this transfer transition, when they get to territorial center of social support, they then do not understand whether this person should be referred to the military medical commission as who, as a man or as a woman. And despite the fact that the person has finalized the transgender transition, and the person has all the certificates, all the documents, but still there is a question how to act here, because in our legislation there's no such thing. In the order, there's no such a thing as that such a notion as going to military medical commission for trans person, and the community is asking the question, so what do we do then? Legislators do not have this norm, but then what do we need? The legislation doesn't provide for us going there and introducing these changes. Please raise hands those who, after the gender transformation, went to the military medical commission. 3 persons just agreed that is emotionally difficult to do that, and it's discrimination. When we go to this institution, they send you to different doctors' offices, and in our organization, the person said that when they came to the military commission, the person was saying, I see that you're a woman, but you could have been a great guy. Why did you need to do that? And the stigma on behalf of the doctors to say nothing about other people who work there, but the doctor on the one hand understands what the diagnosis is, but those people who work there, they don't understand. And then the question is, if the person wants to go to the army, then to which battalion, where there are guys or where there are girls? And these issues are something that concerns everyone, because there's nothing about that in legislation. One of the cases, there's a judicial case about the trans woman who was trying to leave the country. And the question was, who, I would like to ask you, who left the country and who crossed the border after transgender transition? And that is quite a case in Ukraine, because thanks to it, we would like to learn if a person, after the person changes the gender, whether the person should go and change all the data and go again to the military medical commission, so that they give you the correct diagnosis, but that is something that the person could do all the time. and there is a person who has not reached the logical moment, and such a person is trying to get the opinion that the person is not fit for military service because of the diagnosis. Again, the sound is interrupted. Sorry. We're talking about the passport, and there is the resolution also, and they have the right to check it.
Вони вирішили перевірити, тому що облік особи, вона є різною, ніж в документах. І вони такі, давайте ми подивимося, що у вас записано в оберіг. І коли вони вбили ідентифікаційний код, а за ідентифікаційним кодом було прописано, що це, ну, допустимо, там Іванов Іван Іванович. І вони такі, опа, так це ж ви військовозобов'язаний, тому що ніякі зміни не були там внесені. Хоча, відповідно до наших реєстрів, вони повинні підтягуватися в оберіг, і це є проблема, що не вся інформація на сьогоднішній день підтягується. Тому ми рекомендуємо собою все ж таки ці витяги з органу РАКСу десь у сумочці, щоб показувати, тому що, ну, дійсно в ТЦК працюють дуже цікаві люди і не розуміють, давайте так, не розуміють якихось моментів. І вони оформили саме цю справу, повернули людину назад до України, заборонено було на виїзд. І виникло питання, по-перше, вони оформили...
So I have the question whether they have documented this person as whom, whether they are obliged to carry out military service, and that's why they were denied the right to cross the border. And they say we have to know whether the person who has changed their gender from man to woman is obliged to inform the territorial completion drafting center about this. So I remember in the court when the judge had to consider such a case, they even crossed themselves in to say, "Oh God, why do I have to consider such a complicated case?" Of course, this we have to regard this. After the change of the documents, the Territorial Center for Drafting, whether you have to go to see the Military Medical Commission. Well, if I go over my time limit, please stop me. As far as our organization, the Searchlight Projector, is concerned, we have quite a lot of cases when we see violations of international humanitarian law, and also some cases that are qualified under the criminal code. Could you please raise your hand what sympathize? This means the sexual violence during the martial law. Who knows any cases that are connected to this? there was a case when a person was crossing the outpost line and they took him by his hand and said, if you will be coming here again, we will rape you. And where is respect here? Some people think that sexual violence is rape, but no, this is not necessarily rape. This is also the threat. And of course, we are giving lectures to our investigators, to prosecutors about this. And we have met quite a lot of misunderstanding. And our organization has produced an application, mobile application that can be consulted with. We have produced it starting from the scratch. And we can document violations due to this application, because if you see something, you can launch this application and they will record what is happening in the real-time mode. And then, of course, our organization, Projector, the Searchlight, will follow this up in order whether this has happened, where has it happened, because otherwise, for instance, if you walk the streets in the night and no one sees this, there is no way you can prove it. But due to this application, you can document the case and finally find the solution and restore justice. See that justice is done. If you have any questions, please. Thank you very much, Vitaly. I want to say that maybe this is going to look like an ad, but the lawyers of Projector, the Searchlight, are very much qualified, and more than that, they are very well informed about the ways they can help people from the community. And now we will talk about another important topic. We will take some questions later. If we're talking about violence, then of course we should talk about the violence reasoned by gender, where the reason is gender, because this does not only pertain to women, this also pertains to transgender people. So within 15 minutes, you will tell us about this. Thank you, Yulia. We're actually a shop, not a... We are a charity organization, not the public organization. Diana Sachura. What is the gender-based violence? Please raise your hands. Who knows this? Oh, God, everyone knows. Maybe I should just be silent. The violence in this case is the violence aimed at a person due to their gender. And the gender-based violence is one of the most widespread human rights violation in the world. And although men are also suffering from this, most of the people who suffer from this are women and transgender women. And the level of we still can say that most of the sufferers, most of the survivors are women. However, men also address us. We also know that quite a lot of our military men are suffering from gender-based violence in territorial drafting centers. However, they actually address our organization or other organizations less often than women. And of course, if the motive of the offender is connected to people's gender, then we can say that this is gender-based violence. If this is connected to alcohol or drugs or economic reasons, then this is not necessarily gender-based violence, even if this is aimed at members of this community. Psychological, physical violence, psychological violence, sexual violence, any sexual actions without consent, economic violence, the control over funds, ban on work, financial blackmail, and other. Our community meets different forms of violence quite often. I will show you a pie chart later about the situation in our community with this. However, I would like first to talk about physical violence. If we come to a doctor and we are being refused some services because of their prejudices, is this violence? What do you think? Which type of violence this is? Yes, this is physical violence because they deprive us of medical aid. And this creates threats to our health. Psychological violence often happens It often is manifested from the society. However, we may say that teenagers, adolescents are quite often suffering from this kind of violence, and they also suffer from economic violence because teenagers often cannot control their finances, even if they have them. Another example of economic violence is when we apply for a job and we are being refused by an employer. We know, of course, that they cannot refuse because of our gender and their identity, but they say that they, for instance, say that you don't have enough experience. Yes, economic violence, because we lose an opportunity to earn. I was quoting these examples in order for you to understand how violence works. So how our project works. Before this session, I have given you some sheets of paper with our questionnaire. There are 10 questions there. I saw some of you actively filling these questionnaires in. I think that you have read it. I must tell you that if you have answered often or sometimes even to two questions, the probability of you being a victim of violence is very high. And you have there printed phone numbers which you can use to talk about this gender-based violence, but you can also talk to me. Of course, there is consulting, there's also readdressing to a psychologist as a means of aid. And this is very good when you work together with a psychologist when you are solving these problems of gender-based violence. And sometimes, because we are not psychologists, we can offer you some scheme that would very much upset you. And we have worked with these psychologists during our first year work. However, you have to ask the client whether they want this.
Результати впровадження. Ми почали, перший наш пілотний був проєкт у 2024 році. Ми почали в липні. По листопад
We started in July. In 2025, we asked 50 transgender and non-binary people. That is the statistical data for January. October, now we can say 55,000, and that's the pie diagram. What were the types of violence? Most psychological, and then when parents control their children, economic, psychological, then in couples, it happens. One partner controls another one, physical violence. It's again one of the consequences of psychological violence, and people who were suffering psychological violence, that was the violence from the society. And then there's a figure which is sexual violence, but I can tell you when I talk to clients, not everyone is ready to immediately say everything. When working with the psychologist, they can disclose, and the sexual violence, the figure could be much larger. How do we implement it into our gender-based violence? We are identifying people who have risks at the stage when there is prevention. We are working on reducing the stigma and also on building up trust via support. This works well because people who trust their health to you when it comes to information about and usually people, when they suffer from violence, they do not immediately go to the hospital or somewhere. They usually first go to some crisis center, to some social workers, and it's about this bridge. And also we can offer the testing for HIV. We can talk about some other services and the social support, the safe sex and other things, and that's what we are doing. That's it.
Я дуже швидко
Thank you, Diana. That is very important direction of work, and there are many violations here. I will send this into the group of the conference, and we have another group. I will send Diana's contacts, and you could address her. We discussed many things. We outlined the main requests, the main challenges related to violating the rights of transgender people. Now let's talk about the programs. First of all, let's talk about the programs which ensure the right of people for testing for HIV. Please start the presentation. So inclusive access of trans community. I will start and then my colleagues will support me because I'm leading in this direction organization partner, and I will mention some general things. So these programs are implemented by the Global Fund with the support of the Alliance of Public Health. These programs are unique because transgender people have the support of those who are specialists and social workers who understand these things, who are specially trained, and very often in our organization that's done by transgender people, and that's according to the program peer-to-peer. And we have Leon Kushnir who's working on that, and also Natalia Zhurevleva is here, but she's also working in Dnipro. In other organizations, there are other people like that. And that is the activity which 9 organizations are involved into, and they provide such services in 12 regions of Ukraine: Avante in Lviv, Victoria in Khmelnytsky region, Healthy Planet in Ternopil region, Perspective Zhytomyr region, of course, Convictus Ukraine Charity Foundation, which works in Kiev and Kyiv region, our organization partner that works in 4 regions: Odessa, Dnipropetrovsk, Mykolaievsk, Zakarpatska, our future region, Kharkiv Charity Foundation, Vaga, in Kharkiv region, and Kherson Regional Charity Foundation, Kherson. A few words about intermediary results for all organizations, and that's for the first half year of 2025, and that is what Alliance of Public Health provided. There are 9 organizations, they work in 12 regions, and 1,881 transgender persons received the minimum package of preventive services. What are they? Consulting on HIV, then the sexually transmitted diseases, screening on TB. Screening is just primary survey, and if some suspicious symptoms are detected, then the client is referred to the specialist, to centers, and it's examined deeper. Also, we distribute the materials. Also, we apply different types of trainings. So basically, our work is give recommendations to the client, and in their presence, the client takes blood himself and makes this HIV testing. And during this testing, he is given the consultation. And parallel to that, there is also the comprehensive package of services. We are not just preventing. At the request of people, we can refer to the consultation of endocrinologist, psychologist, and lawyer. And people are involved into the group's psychological support. And a few days on auxiliary services, 12 persons received substantive hormonal therapy. Why?
Згортаються гуманітарні програми у всіх напрямках.
In the same way,
Так само згортаються
well, the
гуманітарні програми
humanitarian programs are being closed, and they previously were providing special
Тобто лише 12
preparations,
людей
but
все ж
now
таки
these
змогли
people
отримати
received the
медичні
necessary
препарати.
preparations, medicine.
Наразі
Now
препаратів
there are no
немає,
medicines.
шукаємо
We are looking
можливості,
for
але
new
у нас
opportunities,
готовий проект.
and
Можливо,
we
деякі
are
далі
starting the
колеги
project that
про
my
це розкажуть.
colleagues will talk
Декілька
about.
слів, але таке
And we
також
do
є
have a new
зовсім
perspective
не
that
надання
we are
взагалі
looking for
шукаємо
new
можливості,
opportunities which
але вони
are
є.
there. In the result of testing, 3,127 persons were tested and 7 positive were identified. 6 started antiretrovirus therapy. We had done 625 testing for syphilis, 687 for B, hepatitis, and some C hepatitis. Ruslan Partsvania and Leon Kushnir will talk about our organization. Greetings to everyone. I would like to thank all the speakers who were making presentations before me. The work they are doing is very valuable, not just for trans community, but for the society, because that's very important. Now, I would like to tell you about the organization. We started working, this partner organization started working in 2006. We have 42 persons. And the regional centers that you see in the map, Odessa, Mykolaiv, Kherson, Kyiv, Lviv, Kharkiv, Uzhgorod, Dnipro. We have also offices in Odessa, Mykolaiv, and Dnipro. The target beneficiaries of our organizations are the representatives of vulnerable groups in Ukraine, and these people from LGBTIK plus community, men who have sex with men, and also transgender people from 2016 and consumers of psychoactive substances. We've been working with them since 2019. The main directions of our work is prevention, also TB and others, advocacy and mobilization. We provide humanitarian support. We implement educational programs. We work with the police. We also conduct the provide assistance from the doctors, lawyers, and psychologists. We have multidisciplinary teams, which include the doctors, lawyers, and psychologists, and they're very friendly. They give consultations free of charge, and that's thanks to Alliance of Public Health and Global Fund. I will also add a couple of words about what Yulia mentioned. We have started launching the project from the 1st of July, and it goes together with the ZGT, and I will explain what it is. We can provide these services to 67 persons. They have to be unique, and all the details will be in our Instagram, and you will see the QR code a little later. Now I will give the floor to Leon. A little bit of statistical information for 2023-24. You can see there are more people who go to get testing in 22, 950 1% was tested, 951% were tested, and in 24 more people learned about us. Maybe it was because of the Instagram, of social, social media, and people would come to us to get tested. Many people are afraid to be tested because they're afraid that the information will be widespread, but that's all confidential. We are ready to explain everything. We explain everything. Most people, they come, we share the information, and that is why the number of tested people and people who know about their status is bigger. We also give tests for self-testing and preservatives and the lubricants.
And of course, we also share this and spread this with the trans community. Last year, there were 40 cases of this sort. And 100% of indicators were established. In 2025, we actually reached some progress, and I think that in 2026, we will continue successfully. This is all being done for the sake of your safety, and the main achievements as of 2025, we provide psychological and legal aid to the community and also share our knowledge about how this was done in other countries. We readdress people to different specialists, psychologists, a lawyer, maybe psychiatrist, and we send them to friendly specialists. We are present in 8 regions of Ukraine. In 4 of them, we have prevention sites where you can undergo a test, where you can get lubricants and condoms. Previously, we were handing out petty boxes. As of now, we don't anymore carry out this project, but we hope that it will be resumed. There's also advocacy project, talking to people at every level. And I think that this is a hefty contribution to the safety of the trans community of Ukraine. We try to provide every sort of help, including prevention of HIV and other diseases. You can read more, see more on our Instagram. We also have a Telegram bot. You can take a look at this bot. Thank you very much. I want to add something about the Telegram bot. I think this is a very important technology that we can even call innovation technology today, because as far as the research of our people is concerned, our people mostly hover in Telegram. That's why we decided to create this Telegram bot. You can get any sort of information there. There's also a publication that we are publishing. there's a guide to transgender transition where all the procedures are listed, and this all is there in this bot. And also this bot has links to all the offices where you can get support, and these links are also not only to our partners but to organizations which can name other organizations in all regions of Ukraine. Now I give the word to our friendly doctor, Ilona. She's been working with us for quite some time, and such people are very important for our trans community because many doctors do not know anything about us. And endocrinologist, of course, is the doctor who stays with a transgender person for all the life, because people who change their gender have to use replacement therapy hormones for many years until their life lasts. And of course, many doctors in our society just don't know. They do not have to be against, and they just don't know. And we cannot blame them for them because they were not just taught about this. And of course, every medical establishment begins with a nurse. And when a person comes to a medical establishment and sees prejudice on the part of a nurse, they just turn away and go away, turn around and go away. So we started to train nurses, and Ilona was actually, I was there during the first training. I was just beginning my speaker's activity at this time. When I speak to our people in the hall, it's friendly, but when I speak to doctors who are not very much inclined to hear us, you have to find a pair of eyes into which to look. You have to look. So I actually found Ilona's eyes, and there was this intense view and intense look and the raised hand. Thank you, Yulia. It's a very pleasant memory. It actually started from that moment. This conference became a decisive event for me. I actually got convinced that I want to work in this direction, that I have quite a lot to learn, that I have quite a lot to do. So I'm Ilona Sanko. I'm a blogger, I'm a private practitioner, and as far as something interesting is concerned, I'm now writing a book about transgender transition in Ukraine. So my question to you is, what do you want people to know more about so that I can spread this? A bit about what we're going to talk about doctors, about the problems of this topic of transgender transition in our medical activity. I work since the July of 2022 in the topic, in the direction of transgender transition, and I have seen dozens of patients, And I also train doctors so that they know more about this topic. I haven't seen a single doctor who would say, oh, transgender, I won't work with them. They do accept and receive information if they are given the information. And I am talking more and more about this, how we can make the society to think and know more about this. I'm not from the LGBTIQ plus community, and people listen to me intensely. I conduct webinars, I conduct different conferences, and it pleases me that I'm being invited by owners or managers of private clinics so that I tell people how to work with transgender people. And they used to have some people who came to see them, but they didn't know what to do with them. So I think that it is very important that doctors know more about this. And you have to understand that it is not just single doctors that want to know about this. This is about clinics. Why the consultation, doctor's consultation is so expensive? There's a parallel. Let's say there's a doctor in a polyclinic who has some salary. They know that they will get 100% of this salary. And of course, there are however many patients they see. And of course, there's a doctor who works for themselves, and they get only according to the number of patients they've seen. And you know, the doctors in hospitals are so busy that when I tell them, would you like to hear me? I'll tell you about this, I'll tell you about that, but they say, no, we don't have time for this, and I can understand them. They have such a workload that they can hardly find time to listen to what I can tell them. However, they hear more and more about this, and they want to know more. I didn't know who trans people are when I was at the university. I didn't know who trans people were. Only when I became an intern, I got a message from some person who wrote to me about trans people. So I had no idea about this, and this is a problem, because many doctors would like to help you, but they don't know about this. So the problem is to find a friendly person. If you connect to them, if you like each other, then a doctor would put the things in order. However, the question is how much time this will take. And by the way, there are questions that should be addressed not to a doctor, but globally. This last phrase is rather important, I think. When a person from LGBTIQ plus, seeing such person would cease to be an initiative of individual doctors, but become a business or a endeavor of the entire medical community, then we will be okay. When you come to see a doctor and they know how to help you, this is very good, this is classy. I mean, this is a person who have already allowed some time to get to know about the problem.
Я не знаю, тобто різні лікарі чи
And of course,
по-різному
different doctors are
але
motivated
от
by
саме цей лікар,
different
якщо він знає,
things.
як вам допомогти, значить він чимось замотивований, значить
However,
класний.
this does not mean yet that if they are motivated, they are high-class specialists.
Також наша сьогоднішня важлива тема.
Then, of course, if they are high-class specialists, this does not necessarily mean that they are motivated.
Трансгендерні люди,
And
які живуть відповідно з цим все життя, вони знають більше, ніж я.
there are transgender
Що
people who know
як ви вже
about
сказали,
this more than I.
Так,
No,
я
I've
впевнена,
been
що ви
working
знаєте,
in
тому
this
що ніж
sphere
я, тому
since
що ви кожен день
2022, but
щось
I'm sure that you know more
І
about
я
this because
розвиваюся,
you
я
live with
точно
this
не претендую
every
на
day.
право там
I'm
сказати
developing, and I
свою
don't think
думку.
that
Це
I am
об'єктивно
the cleverest
є різні.
endocrinologist,
І тому я навчаюся
so
також
I am
тому,
learning.
намагаюсь
I
переймати
also
досвід
try
інших,
to
намагаюсь
take
більше
experience from my
читати,
foreign
розбиратися
colleagues.
навіть питання кожної
And
людини і на
also,
консультації,
of course,
навіть на
every
консультації
question from every
завжди,
person
тому що
during
питання
consultation or
можна
during
буде
such a
змістити, в чому
conference
я буду ще
is
більш
important
працювати,
because
чому
it
я
will
вкріплю свої
stimulate me to get to know something new.
І в чому
And now I will go back to self-treatment. What are the minuses of self-treatments? The people who do this,
в кого класне здоров'я, все добре і все взагалі питань немає.
some people can have complications,
Можемо
and we cannot predict who will have complications, who won't. That's why I insist on examinations. You should do this by all means, the examination. If you want a list, I'll do it for you.
What are the risks? The clients very often write that I would like to find out that I started hormonal therapy independently. That's something classic that happens very often. And I thank the clients because they go to us and let us select the correct doses for your specific organism, because hormonal therapy is something that you take for a long period of time, and we would like you to have a comfortable life. And also, I would like to say that we can worsen the quality of hormonal therapy if the person doesn't move enough, if the person has extra weight that complicates things. It could increase all these risks. You can see these risks. The risk may be higher that based on extra genes, there could be thrombolia. There could be some risks of heart attacks and others. I don't want to scare you, but there are risks and we need to take care. I hope that I managed with the timing. Here are my contacts. If you have any questions, you're welcome. You will have several questions, several minutes for questions, sorry. Good evening. If it's evening already, my question is, Ilona, to you. As to the specialist, you mentioned something that the consultation cost a lot. I am asking this question. I am a pharmaceutical specialist, and the patients who come to me to the pharmacy, they ask to explain why, what for these medicines are, how to take them, what are the contradictions. These are the realities. And is it after the consultation with the doctor? Yes, definitely. They give the recipe from private hospital, explain what I can But again, you say that the consultations with doctors are very expensive. Why? They could be, why? Why they are so expensive?
Мене підловили.
And I know that you are the most expensive endocrinologist of Ukraine. But for transgender people,
Давайте так, я майже там на цих руки можна перерахувати всіх.
please tell how the price of consultation is formed. Because consultation of a doctor, well, it maybe takes 30 minutes maximum. It depends on the situation.
Моя
My
консультація,
consultation lasts for about 1 hour.
якщо ми говоримо про
Once we're talking about public medicine, I can say nothing. I don't work there.
я нічого в державі не
But why it is so expensive? What for are you taking money? When people come to me, people want me to explain that the work of the doctor.
100% пояснити.
So you are, well, I cannot tell you about all the
Ми
doctors.
зрозуміли ваше
Thank you
питання.
for your question. Let's allow
Давайте я
try
спробую,
to answer.
тому що я знімаю з себе
I
відповідальність.
will not be responsible for all the doctors of Ukraine. I can speak from myself only.
Що входить?
Why is this consultation expensive?
Я закриваю по факту дві консультації
I
однієї.
basically, it's one consultation instead of two.
Яка в неї є
I
потреба.
talk to a person, I find what is the need, I
Їй потрібно зробити.
select what the person has to do. I don't tell her go to this first consultation.
Я одразу це можу зробити.
I
Це скорочує
basically can make it quick, that reduces the time. Then my consultation, in very individual cases, it could be brief when the person comes to me regularly and I just look at some indicators, but it could be quite lengthy, especially if it is primary consultation. It sometimes lasts for an hour. Then I teach the person. I'm not interested in having this person visit me every 3 months. The protocol says that the first month you go, initially first year you go every 3 months to the consultation. That's important. I teach person how they can themselves control control that how and when they have to substitute one medicine by another one. So there is a list of the doctors to who you can write and get an answer. Cannot hear.
Чекайте, у нас же ж
We have people online.
І в мене стала ситуація, коли я в паніці написав
Мгм.
Ілоні,
I
і
wrote to
вона
Ilona and Ilona
послухала мене і
gave
направила
me
в
a
кінці
consultation.
І
She told me which analysis I had to do, to what doctor I had to go. It was free of charge. The person didn't refuse me, so I believe the person is in contact, and that's the advantage. Thank you. Thank you.
Будь ласка,
Any
ще
other
питання в
questions?
залі?
We
У нас
still
є
have a
одна
couple of
хвилина, можна
minutes.
прийняти декілька питань до будь-кого зі спікерів. Будь ласка, Хільга.
Юль, можна Юля, я тут. Можна ще додам?
May I add to that? I would like to share my experience. Ilona was my first endocrinologist to who I went. When I heard the price, I thought it's so expensive. but
суть в тому, що
I
я
went
пішов
to
шукати
try and I
і
paid and then I
я
understood
потім
what I
зрозумів,
was
що
paying for. The first
консультація була
consultation lasted for
приблизно
30-40 minutes. Ilona explained everything.
повністю все. Тобто вона
She told me what steps should I make, and I believe that I paid for this one consultation so much. But then she said, it is the money for the whole month. I was writing any time of day and night. I just started taking testosterone, and I always had questions whether that's good or bad. And I was writing to Ilona, she was answering. After that, there were 3 consultations for the same for that price. Every day I was writing to Ilona. That was for the first time in my life. And that was the price for comfort. You understand what you pay for. And I even went to give analysis, give tests, and well, then Ilona said, don't pay for the next consultation, let's just talk over the phone. That is very friendly attitude to person. And plus, that's professionalism of a person. Then Ilona explained how to just follow it up yourself. Basically, she explained everything. Now I know how I can follow all the results. Thank you.
Дякуємо, Петро.
There's a question in the audience.
Так,
Thank you.
Я
The sound gets interrupted.
часу не вистачить, тож я буквально
Давайте так, одне
One
питання.
question to one speaker.
Так. Отже, я так вирішив, що вже відфільтрувало собі одне питання для
One question to Ilona.
Так, що ви згадали, що плануєте
You mentioned the book,
з'явилося прямо таке питання.
and my question is,
Дуже турбувало на початку ЗГТ. Ну, зараз робити вже, я тільки починаю. І, отже, як ви вважаєте, який, на вашу думку,
what is the best way to get
діставати такі різні ефективні засоби
to
захисту,
get different things like injections,
і все інше, що у нас існує, але не
everything that is there, but it's not accessible in Ukraine? What is the best? Let me ask you again. You ask about what is the safest way where to get this medicine, which we don't have in Ukraine. That's complicated question. Why we recommend the medicines from the pharmacy? Because they were registered. We know that they were transported correctly, that some research and surveys were done. Those, for example, let's say there is a person that makes injections in Ukraine. Everyone knows this person. If you take it practically, it works. People come to me with them, but please, not in the doses that their producer recommends, because estradiol goes up.
Я хочу додати, що слід зауважити.
I'd like to mention that when you use these preparations, when a person is young, that's one thing, but when the person is 35 plus, and the person has some diseases and they're individual for every person, then you need to understand what your condition is, and then we need to talk about the individual dosage. No, just select the dose that would be good for this person. And maybe one is good for one person and another one would need 3 times more. Let's give the floor to Anastasia. My question is, Well, basically, those people who come to us, the partner says who we could refer. And the second question, you mentioned that you work with people who use psychoactive substances. Sorry, the sound got interrupted. We work and we are represented in 8 regions of Ukraine. In every region we have consultants. In the centers where we have offices, we give testing. We work with family doctors, psychiatric psychologists, and endocrinologists. We have such specialists in Odessa, in Dnipro, and the Transcarpathian region and Mykolaiv. We can also give online consultations, and there is the reference, the link to Telegram bot, and you can ask the specialists online. So we were providing services till the end of this June, and these were party boxes. And if a person uses the psychoactive substances, then they check that they are of good health, good quality. Also, we will give all consultations to such people. Now we are working together with the organization Way Home. That's the organization from Odessa. We work in cooperation. We provide all the services plus more. And they give some special type of service. I will not decipher what it is. And then we will also do some survey as what will be needed for the future for the Global Fund program. Can you tell about your free of charge doctors? Yes. Thank you, Diana, that you mentioned it, and it's basically an advertisement. It's very popular to support your own health with the assistance of antidepressants. We have one doctor who's abroad, and she prescribes antidepressants, and our organization has a doctor who works in Kiev. If you require the offline consultation, you can come to us. When you receive the prescriptions, then you can request the compensation for antidepressants. Our time is over, so we can answer only one more question. And one from Natalie, and that's it. My question is to the doctor. I work with transgender community. I've been working for many years. First question. Can people come to you online or offline? Online. Online, yes. And another one. Do you have any discounts? Maybe you have some Black Fridays. Maybe there are some special, like events when you provide discount. If a transgender brings a friend, then we'll get a discount. Okay, we'll organize it. Thank you. Thank you all the speakers. Thank you all those who participated in our work the first day and the second day. It's a pleasure. But the second day we have representatives of other spheres of LGBTIQ because we work And we hope that this year will get consolidated and we will all join one single movement. We thank you for being with us. Thank you, everyone. And join us next year. Follow our events. I would like to thank our speakers, our technicians who helped us a lot.